Hi everyone. Today we continue with our sexual transmitted diseases series, and I will be talking about syphilis. Syphilis is a very old infection that we've known about for many centuries, and I'll give you a few historical facts about syphilis at the end of this talk. Syphilis is caused by a bacteria. This bacteria is called Treponema pallidum. One of the colloquial names for syphilis is Lewis. Due to historical facts and how the disease moved around, it's got various names such as French disease, Nepalese disease, Italian disease, Russians call it Polish disease. So depending on where it came from to a particular country, it got different names, just like COVID-19 has been given names of a particular country where it originated, same with syphilis. In fact, another interesting fact about syphilis, as many other infections, it has crossed over to humans from cattle or sheep many years ago, most likely through sex. It is a sexually transmitted disease, and it's transmitted through oral, anal, vaginal sex. People who are at most risk of syphilis are people who have men who have sex with men, people who live with HIV due to their immunodeficiencies, people who are in polygamous relationship are of course more prone to any sexual transmitted disease, including syphilis, and people who don't use condoms protection during sexual intercourse will be more prone to get this disease. Is syphilis common nowadays? Well, it is common. There is about 400 million cases diagnosed, new cases diagnosed every year. When I think about my clinical practice and how often I see syphilis or pick it up for the first time, it's actually not so common. And I do see quite a lot of patients who I screen for sexually transmitted diseases. And nowadays I pick up gonorrhea, chlamydia, I pick up HIV at times. But if I had to think about diagnosis syphilis, it's actually something quite rare. Syphilis bacteria can be transmitted from a woman to a baby during pregnancy, and that will result in congenital syphilis, or baby being born with syphilis, which is quite a bad disease to have, and it's really easily treated if we know that woman has syphilis. Hence, all pregnant women have syphilis tests during their pregnancies, and if it's positive, we would treat it. So at times when I see pregnant women and do screening tests for them, I would pick up positive syphilis tests, but it is not common in my practice. How does one know that they have syphilis? So syphilis has 3 stages: primary, secondary, latent syphilis, and a tertiary syphilis. Incubation period, or the time from getting the syphilis through sex till developing symptoms, is in average 3 weeks, and it ranges from about 10 days to 90 days. The initial symptom that people have when they acquire syphilis would be a sore, which is firm and round and not painful. Hence, it's quite easily missed. If you have no symptoms and you have a sore and you haven't noticed that you developed this sore, then you may not even know that you've got this infection. The sore usually develops in a spot through which syphilis enters the body. The sore is called chancre. And if we take a test from the sore, we would find syphilis bacteria, but we don't often see that. The next stage develops in about 6 weeks or so, and it usually associated with people having rashes of all kinds, fever, and swollen lymph nodes. And such symptoms can be related to many other illnesses. Hence, it's not so easy to work out that it might be related to syphilis. But if we do a blood test at this stage, we would diagnose syphilis and we can treat it. However, if this is missed and thought to be a flu or some other easy illness, this stage passes on. Syphilis bacteria remains in the body and can cause us permanent, quite severe damage to organs in our body, to blood vessels, to heart, and even brain. And this damage can occur in 10, 20, 30 years. So someone can live with treponema bacteria in their body not knowing about it and end up with dementia or severe heart disease or deafness or psychosis, psychiatric illnesses. And that will be related to syphilis if we didn't pick it up earlier. Is syphilis curable? Yes, syphilis is curable, and it's curable quite easily with penicillin. So this syphilis bacteria, Treponema pallidum, was discovered in 1905, and we did not have cure for this disease until much later, 1940s, when we discovered penicillin. Once penicillin was discovered, we realized that this disease can be easily cured. However, damage that occurred from syphilis to, for example, brain or heart, unfortunately is not possible to cure, but it's possible to stop it and prevent further damage. I'll give you a few interesting facts about syphilis, and as I've mentioned, we've known about syphilis for years, and it crossed over from sheep or cattle to the humans many centuries ago. There is a number of famous people who had syphilis and died from syphilis and had all kinds of signs of this terrible infection, terrible disease that influenced history of the world, actually. So Christopher Columbus had syphilis. We think that Adolf Hitler potentially had syphilis. Abraham Lincoln, Friedrich Nietzsche, Vladimir Lenin also had syphilis. It's possible that Beethoven's deafness was caused by syphilis. And William Shakespeare is amongst others who also suffered from syphilis. One of the common things that those famous people had is that they all had some kind of neurological damage and related to this illness. There's many more others who are thought to have syphilis, and kings and tsars that suffered from this disease before the cure was discovered. In all times, syphilis was treated with mercury. So if someone died and we can pick up that they had mercury in their hair, that's how we would know that they were taking mercury to treat the disease. And that's all for today. Have a wonderful afternoon, and I'll see you all tomorrow. Thank you. Bye.